Welcome to the Health Zone. My name is Dr. Toju Chikiobi, but everybody calls me Dr. Toju. We have a terrific show for you today. We will be talking about stroke. And please, before you decide you don't want to hear about stroke, stroke is so important. Do you know that it is one of the top 10 causes of death in sub-Saharan Africa? In fact, not only is it one of the top 10 causes of death, but it is preventable. So you don't want to miss this episode. You want to learn how to prevent it. We have so many great things on today's episode. We'll actually hear from someone who has personally experienced stroke. So that's important for us to learn about. And then we have a terrific guest today, a neurosurgeon who is passionate about stroke and has worked for many years on this subject. In addition, of course, we have the fun part where we go out to the man on the street and find out what it is that they know about stroke. So please, you don't want to miss this one. Stay with us. Welcome to the Health Zone. On today's episode, we will be talking about stroke. And we have a terrific guest with us here today, Dr. Biodu Ogugbo. Dr. Ogugbo is a neurosurgeon that is a brain and spine specialist. And he is the medical director of Spine Fixed Abuja, which is a special purpose vehicle designed to promote safe spine surgery in Nigeria. He's also the public relations officer for the Nigerian Stroke Reference Group. So you can tell that stroke is really a passion of his. He's widely published in medical journals, and he's a real advocate for helping the ordinary person understand the neurosciences. We are really honored to have him with us today. Dr. Ogugbo, welcome to the Health Zone. It's such a pleasure to have you here with us today.
Thank you very much. It's a pleasure to be here.
So, as is our usual custom on the Health Zone, we will go out to the street to find out what the man and woman out there know about stroke. It's our Man on the Street segment. So please don't go away. It's going to be really interesting so that we know how much work we have to do, how much explaining we have to do, or maybe people know enough about stroke and we don't need to talk too much about it. But either way, it's going to be fun. It's going to be interesting. So don't go away. Let's watch the video together.
Today we will be talking to the man in the street. What is a stroke?
Stroke is when you have a clot in the system, I believe. It actually causes paralysis or death.
What kind of people get strokes?
Virtually anybody can get stroke. It's now known that children as young as 20, in their 20s, do get stroke. It depends on lifestyle and a lot of other things.
How do you know if you have a stroke?
If you have stroke now, you're paralyzed. Yeah, the blood can never move part of your body. Half of your body will stiff. And that's stroke.
Do you think that strokes can be prevented?
Yes, possibly they can. Stress is the main source of stroke. So if you live a stress-free life, you might be able to prevent stroke and have your blood pressure checked regularly.
Okay, so we saw some really interesting things on the Man on the Street segment. It seemed there was a little bit of knowledge out there, some of it incomplete. So you tell us, you're the expert, that's what you're here for. What is stroke?
Well, I'm actually happy that a few people know something about stroke. But for the general public now, stroke is paralysis of the arm, paralysis of the leg, problems with speaking, confusion, sudden severe headache, but all of these are caused by lack of blood supply to the brain. So if we look at our brain, different parts of the brain do different things. So everybody can suffer different types of stroke. So no two strokes are the same because it affects a different part of the brain. And it depends on what that particular part of the brain does will be the effect that you get when you have a stroke.
Okay, so what causes that problem with the brain? What causes the stroke in the first place?
Stroke is caused by any interruption to the supply of blood to the brain. And that, in most cases, is because of hypertension. Hypertension can actually damage the blood vessel and so interferes with blood supply to the brain.
Okay. I've been told though that there are two ways in which that damage occurs, right? And so can you explain that, a little bit? There are two kinds of ways that the damage occurs to the ischemic and the hemorrhagic. So break that down to us in everyday terms.
Yeah, those are big terms, but people should know them. People should know that there are two types of stroke. There's ischemic stroke, there's hemorrhagic stroke. Put in a different way, there's dry stroke and wet stroke. And if we use pipes going into a house, for example, if there's no water going to the house, so there's dry pipe, there's dry stroke. If, unfortunately, somebody has turned up the pressure, and so now there's water flooding the whole house, that's wet stroke. So we have dry stroke, wet stroke, ischemic stroke, hemorrhagic stroke.
And high blood pressure, hypertension can do one or the other.
Absolutely.
Okay, so what are some of the things that puts you at risk for stroke in addition to hypertension?
Well, in addition to hypertension, we have diabetes. Diabetes can also increase your risk of stroke. People who smoke have a risk of stroke. Us just being black, our race also puts us at a risk of stroke. Women, for example, who take oral contraceptive pills, they also have a higher risk of stroke than the ordinary person. So there are so many different factors. And if we even look at us here, younger people have a risk of stroke because sometimes of sickle cell disease, which can lead to blockage of blood vessels going to the brain.
Okay. So what are the sort of symptoms that you get from stroke that would be a clue that you have stroke or you're developing a stroke?
Well, the commonest symptom for stroke really is weakness of an arm or a leg.
Okay.
But other people can have blurring of vision.
Okay.
Some elderly people can have just confusion. And all of those could be because of dry stroke, for example. Now, when we talk about wet stroke, because that increases the pressure inside the head, since there's bleeding inside the brain, they get a massive headache. So sudden, severe headache. And this is important. This kind of headache, people would describe it as they've never had that kind of headache before in their life. So it's not like migraine, for example.
Yes.
So sudden, severe, horrible headache that you can't bear, you can't live with this. You need to check to make sure it wasn't a stroke.
I know that there is something called a mini stroke. So what is a mini stroke?
A mini stroke is a small stroke.
Yeah, mini,
but
of course.
Essentially what it means is that you may have had sudden blindness or sudden weakness or paralysis of an arm or a leg, which goes away. And that's the fundamental thing here, that the symptoms go away.
Like how soon?
Within an hour, certainly within 24 hours, you become completely normal. However, that's the real danger, because that's actually a warning sign. So a mini stroke is a warning that there's a bigger stroke coming within the next 24 hours, certainly within the week, within the month, within the 6 months, or for a lot of people during that year, there's a bigger stroke coming.
So what are the other complications from stroke other than paralysis?
Well, apart from paralysis, it could lead to permanent blindness. It could be, hearing loss, problems with memory. Definitely, some people have problems passing urine or passing stool. And, you have paralysis, for example, which could keep you in bed. So you lose, you can lose your job because of this. You lose your sexuality. You lose your ability to be who you are. So stroke actually does a lot of damage. And that's if it doesn't kill you.
Okay. Say I'm with my father, for example, and he starts to act weird. What are some things I can do that can give me a clue that what he's going through is a stroke?
Okay. There's a mnemonic called FAST. F-A-S-T. F means face.